This video may be paused wherever you feel that you need time to understand any concept. Energy supply and the effects of exercise on the body. Aerobic and anaerobic respiration. Learning objectives. Describe the process involved in converting food to energy. State the questions for both aerobic and anaerobic respiration. Link the use of aerobic and anaerobic respiration to different types of physical activity. Converting food to energy. Any movement needs muscles contraction, but in order to do this, the muscles need energy. Energy comes from food, which is a mixture of different substances. 1 carbohydrates, 2 fats, 3 proteins, 4 minerals, 5 vitamins, 6 fibers. Food is broken down in your stomach into a liquid in a process known as digestion. The components within this liquid can pass through into your blood and be carried to your cells for energy, growth and repair. During digestion, carbohydrates are broken down into glucose. Some glucose gets stored in the liver. It is released when glucose levels in the blood falls too low. Some glucose gets stored in the muscles as glycogen, and the rest is carried to other cells in the body. Glucose is an important energy source needed by all the cells and organs of our bodies, commonly called sugar. Glycogen is a form of glucose stored in liver and muscles. It is a form of energy that muscles can use immediately. Aerobic respiration. Aerobic respiration is respiration that takes place in the presence of oxygen. Oxygen is transported to the muscle cell through red blood cell. The oxygen combines with glucose inside living cells to release energy. This allowed the muscle to contract and create movement. The process of converting glucose can be summarized as an equation. Glucose plus oxygen is equal to carbon dioxide plus water plus energy. During the process of converting glucose to energy in aerobic respiration, several things happen. Heat is produced. In normal respiration, this heat is used to maintain our high body temperature. Water molecules are created and transported by the blood, either to be used by the body or expelled from the body as urine. Carbon dioxide is created and removed by the blood and exhaled through the lungs. Anaerobic respiration. Anaerobic respiration is the process of converting glucose into energy without oxygen. Energy is produced quickly and used for explosive activity. It can be summarized as a word equation. Glucose is equal to lactic acid plus energy. Conversion of glucose to energy in anaerobic respiration. During the conversion from glucose to energy, a waste product called lactic acid is created. Lactic acid makes your muscles tired and painful. It also prevents further energy being created until it is removed. Oxygen is needed to break down lactic acid into carbon dioxide and water, which is then removed from the body. The extra oxygen needed to do this is called the oxygen debt. Getting this extra oxygen is essential to return the body back to its resting state. The diagram below shows the conversion of glucose to energy. Graph representation in terms of energy supply and time. Recovery. Learning objectives. 1. Know why the body experiences an oxygen debt after strenuous exercise. 2. Explain how oxygen removes lactic acid from the body. 3. Describe how excess post-exercise consumption, EPOC, can be achieved. 4. Outline the factors affecting recovery time. Oxygen debt. Oxygen debt, a temporary oxygen shortage in the body tissues arising from exercise. Oxygen debt is the amount of extra oxygen needed by muscle tissue to oxidize lactic acid following exercise. During vigorous exercise, the body needs a lot more energy, and therefore has to get more oxygen into the muscle tissue where energy is needed. Anaerobic respiration produces an oxygen debt. After intense exercise, the body requires more oxygen that is normally needed to remove lactic acid in the cells. The amount of oxygen needed to bring the body back to normal is called oxygen debt, as the body needs to pay back oxygen into the cells. The process of taking additional oxygen is called excess post-exercise consumption, EPOC. Excess post-exercise consumption, EPOC. EPOC, the process of taking in additional oxygen needed by cells in the body to remove the lactic acid created by the anaerobic respiration. Lactic and alactic component. The anaerobic alactic is the fastest and most powerful system. This system works without oxygen, does not produce lactic acid and lasts for 6 to 15 seconds. The anaerobic lactic works without oxygen, produces lactic acid and lasts about 2 minutes. Energy supply, metabolic pathway. The diagram below shows oxygen consumption during rest, exercise and recovery. Lactic acid equation. Lactic acid plus oxygen is equal to water plus carbon dioxide plus glucose. Oxygen is used to convert the lactic acid into water, which can be used elsewhere in the body or excreted in urine. Carbon dioxide, which is carried to the lungs by the blood and exhaled. A small amount of glucose, which can be used as energy by the muscle. The table below shows some factors that influence recovery. Short-term effects of exercise. Learning objectives. 1. Identify the immediate effects of exercise on the body. 2. Describe what happens to the body during exercise. 3. Explain the negative effects that impair performance. Effects of exercise on the body. Heart rate and breathing. The first effect you probably noticed during exercise is that your heart rate increase. As the heart pumps faster to send more oxygen through the blood to the muscle to turn glucose into energy. Exercise also causes adrenaline to be produced, which is sent to the heart causing it to beat fast. Adrenaline, a hormone secreted by the adrenal glands that increases rates of blood circulation, breathing, and carbohydrate metabolism and prepares muscles for exertion. Effects of exercise on the body. Breathing rate increases, an increase in the amount of oxygen entering the bloodstream via the lungs. The diagram below shows the breathing rate of a fit and an unfit person. Effects of exercise on the body. Heat control and reddening of the skin, start to feel hot. You probably start sweating and your skin may turn red. Heat occurs when the muscles are contracting. The skin will become red as a result of blood vessels close to the surface of the skin becoming enlarged. Sweating. Sweating also enables the body to control its temperature by sending water to the surface of the skin released by sweat gland. Fatigue. Another noticeable effects of is that you being to feel tired. Fatigue happens when muscle fibers work at their maximum for too long. Nausea can occur during exercise or shortly after it has stopped, especially if you overexert during exercise or do high-intensity exercise too quickly. Lightheadedness. After you finish a strenuous exercise session, you may feel unsteady, slightly dizzy or lightheaded. This is a result of a change in blood pressure, as when you exercise, your heart works harder to pump more blood to your muscles. Long-term effects of exercise. Learning objectives. 1. Identify what happens to the heart after training for a period of time. 2. Understand the effects that changes to the heart have on the body. 3. Understand how blood is able to tolerate lactic acid. Long-term effects of exercise. 1. Increase in the size of muscles. 2. Loss of body fat. 3. Heart size, hypertrophy. One organ that feels the benefits of regular exercise is the heart. Long-term aerobic training will cause changes in the muscle walls of the heart, making it thicker and stronger. It will increase the size of the heart, making it a more efficient pump. The heart is able to hold blood and the muscle walls contract more strongly. 4. Bradycardia, lower than normal heart rate. An elite athlete will have a resting pulse of between 40 and 60 beats per minute. Hypertrophy means that the body can work harder, stronger, faster and for longer.